It is one of the core issues in the debate over health care reform. Should there be a government-run insurance program side by side with private insurers? President Obama has been pushing hard for that, saying it is the key to keeping health insurance costs from spiraling out of control. But now there are signs that the administration may be backing off the so-called public option. An effort to accommodate one side in the debate may be causing a backlash on the other. Jake Tapper is at the White House tonight to explain. Jake, good evening.
Good evening, Charlie. Well, that's right. The president's push for a public government-run plan has long been one of the centerpieces of his health care reform push, but now there are signs that he may be walking away from it, and liberal Democratic allies say you can't have true cost containment from private insurers without it.
2 months ago, President Obama suggested the public plan was crucial.
Any plan I sign must include an insurance exchange, including a public option to increase competition and keep insurance companies honest.
But 2 days ago, he said this.
The public option, whether we have it or we don't have it, is not the entirety of health care reform. This is just one sliver of it.
White House officials say this is just pragmatism and understanding that the public option is a lightning rod for critics. One compromise being worked out in the Senate is for the creation of nonprofit insurance co-ops that individuals could buy into. They would be run by those individual members, not the government, and would compete with traditional private insurance.
But, Charlie, House Democrats say co-ops are just not strong enough to compete with private insurance companies and thus drive down costs. The White House says the president has not backed off anything. He still thinks the public plan is the best way to do this, but he has not drawn any lines in the sand.
But will he go to the mat for a public option? You know, he says now it's just a sliver of health care reform, but earlier he said it's a lot more than that.
Well, I think that's exactly right, and I think you saw just what he is not willing to go to the mat for. If it's just a sliver, why would he go to the mat for it? The president, at this point, I think there is a pragmatism that is coming over this White House. They realize that it is more important for them to pass something, even if it is incremental and not everything they wanted to pass, and so they are setting expectations lower and lower.
But, Jake, we talked to several health care experts today, and they all said if you take out the public option in terms of insurance, there's going to be no restraints on the costs of insurance. And one by one, it seems, the cost-saving measures are coming out of health care reform.
That's exactly right. And you saw over the weekend, Secretary of Health and Human Services Kathleen Sebelius also said that it looked like the end-of-life care provisions would also be gone from the bill. And that's another area where they had hoped to achieve real cost savings. So this bill is really being winnowed down considerably.